The Department of Health is expected to hold a briefing later this evening following a report that the coronavirus AstraZeneca vaccine had reduced efficacy against the virus's strain 501Y.V2. On Monday, 1 million doses of the drug landed in South Africa and were earmarked to launch the country's COVID-19 vaccination drive. The study was conducted by the Wits and Oxford Universities. We're joined now by John Bevir in the United Kingdom to talk to us more on this. Hello to you, John. Is it the same sort of concern that we're having now, where people are starting to perhaps begin to worry about whether or not the AstraZeneca vaccine is in fact effective? And what is your government saying that side?
Well, of course it is going to be very concerning, isn't it? You've been pinning all of your hopes, the entire world has, on a vaccine to get out of this pandemic, and now we're told that the vaccine doesn't work against one of the variants that is very prevalent and spreading around the world. What the study has said is that it offers minimal protection against mild and moderate disease. The study, which hasn't yet been peer reviewed, involved 2,000 people with an average age of 31. But I should stress the point that they do still think that it should protect against severe disease, but they don't know that for sure at the moment. So this study is a concern because it seems like it might not be able to drive down the cases and stop people getting this variant of the coronavirus, but it should hopefully stop people from becoming severely ill, which in turn should ease the pressure on hospitals around the world that have been struggling to cope, especially in those countries which have seen another surge. Of course, the 501Y.V2 variant, as it's known, the variant detected in South Africa, that has spread quite significantly, and so this report today is of course of concern, but we're going to get further information tomorrow when the full study is published.
Yeah, and the UK of course has begun its vaccination drive, and we're in fact about to start our own vaccination drive. Just earlier this week, in fact, we received the first batch of the vaccines. How have things changed in terms of coronavirus numbers in your country? Obviously you've been reporting quite a bit on this ever since the vaccination drives started in the UK. Perhaps that might give us an indication whether, things are getting better or not.
Well, the numbers are coming down slowly. It seems that we have reached a plateau and we're now coming down the other side. So the government here are hopeful that the mass vaccination programme that is happening here in the UK is having an impact. But this new study is, of course, of concern to everyone involved. Everyone has been pinning their hopes on vaccination being the route out of this pandemic, and now it seems that things just aren't that straightforward. The good news, though, and what scientists have been very keen to reiterate today on television here in the UK, is that the vaccine can be tweaked to work against these variants. They don't have to go all the way back to the drawing board, and they are in fact already working on those tweaks. So of course that is very reassuring for the future use of this vaccine. But of course at some stage you have to just say, right, now is the time that we are going to produce the vaccine, and of course if other variants pop up afterwards, then there's not a huge amount you can do. I should say that the town I'm in at the moment, just outside of Bristol, I'm here because there are reports of yet another variant. Here they have rolled out mass testing across this area because they're trying to find out more information about what might be yet another variant of the coronavirus, and it's those variants and whether the vaccines work against them that is causing so much concern. for the entire world.
Yeah, and then John, for those people who have and who are so eager, of course, to be first in line, or those that were indeed, put first in terms of taking the virus, have any of them sort of reacted? I would imagine that there's been a lot of coverage about the vaccination and the vaccination drives and reactions, and I wonder now, as the news starts to come in, if you've heard any reactions from those who did in fact take the vaccine, of concern if they'll maybe have to take another vaccine, or what are they saying?
No, I think at the moment here in the UK, everyone is very much behind the vaccine rollout. The UK has some of the highest positive percentages in terms of the number of people who support a vaccination programme and want a vaccine. So I think very much the UK government is going to push on with this mass vaccination programme. They have pinned all of their hopes on vaccinations being the way that we are going to get out of the pandemic here in this country. They have, of course, introduced very strict travel measures and quarantine measures on people coming from more than a dozen countries in southern Africa, as well as all of South America and a few other key countries as well, because the UK government is trying to keep out these different variants that it is so concerned about. There are 100 cases roughly of this 501YV2 variant, this variant detected in South Africa, 100 or so cases of that in the UK. Mass testing here to try and work out if there is now community transmission taking place, and they are urging people in those areas not to go out at all if they can help it. But very much the UK government here is pushing ahead with the vaccine. Of course, not just the AstraZeneca vaccine here, Pfizer and other vaccines as well, but all the hope still being pinned on the vaccine, which is why this report is so concerning. All
right, John Bevir, thank you very much for giving us that update. Much appreciated. All right, that's our correspondent in the UK, John Bevir. And as earlier mentioned, of course, we are expecting the Department of Health to hold a press briefing later this evening following that report that the AstraZeneca vaccine had reduced efficacy against the virus strain of 501Y.V2. So we'll get more information on that, and we'll keep you definitely updated as the day progresses.